So how long that patient's supposed to stay on medication? And the endocrinologist said, well, probably for the rest of his life, because it's my job security.
That's what we want to leave people with.
Yes.
A message of hope that you are not your condition or your dis-ease in your body, and that it's all fixable, reversible, changeable. Welcome to Harmonic Alignment,
A podcast that explores the new frontier of energy medicine,
bridging the gap between Western medicine and quantum physics,
giving you easy and practical solutions.
guided by
Me, Dr. Larissa Sharipova,
and me, Priscilla Koblenz. Join us on a journey discovering your harmonic alignment. In today's episode of Harmonic Alignment, Dr. Larissa Sharipova and myself, Priscilla Koblenz, have a lively conversation on how to navigate the Western medical system. We offer up some ideas on things we'd like to see changed, and also some tips and tools on how best to support yourself and your loved ones as you navigate toward optimizing your health. So excited today to get together, and we're going to talk today about what's going on with the medical system. The good, the bad, and the ugly, and what are some of the solutions, and how we can help individuals and friends and family navigate some of those solutions and how to protect yourself. Dr. L, you have come from a different background. Why don't you start with what your experience was in Russia and the healthcare system, and then what you saw when you came to America?
So when I came here, it was like late 90s. I learned about the medical system because I started working in the hospital. When I was taking my medical boards, I just wanted to see what kind of environment, if I want to become a doctor, what kind of environment is the medical system and hospitals.
Well, that's a
and all
great
that.
idea. So you're like, okay, if I'm going to put all this time and effort and get my boards done, do I want to work in an American hospital?
And I didn't even have any expectation. I didn't know anything about it because I never went to the doctor before that. So I was curious about it, and I was like, I want to start in any capacity to work. And it's interesting also, when I applied to work in a hospitals, in any medical system, when I put that I had a medical education and I was a doctor, nobody could hire me.
Really?
Because I was overqualified for anything that I was applying
Oh,
to.
jeez. So you couldn't even get your foot in the door in a new country. And that's
Because
one
I
of
had
the-
a medical
yeah.
background, I couldn't even qualify for anything that I applied. So when I stopped writing in application that I had an MD degree from another country, I got a job right away. So I had to start and work in an entry job in any hospital. So I started with working in medical surgical floor in the hospitals as a secretary on the floor. And so what I was doing is transcribing physicians' orders, putting them in a computer in the system, what they prescribe to the patients when they come to the hospital to see them. And it was shocking for me that one doctor usually recommend consultation of another doctor, and that doctor recommend consultation of another doctor, consultation, and also recommend different medications for what they feel fit. And at the end of the day, when you put all that in the system, in the computer, nurses supposed to implement all physicians' order. And a lot of time, one medication contradict to another medication. The pharmacy calling, this medication is contradict to other, or they cannot be together. It was so much mess working there and see how it's so mismanaged and misorganized. Everybody is like responsible only for small things that it's supposed to be done by you.
So no one overall is checking in on patient A to say, does all of this make sense? There was nobody reviewing everything and all the decisions being made to say if this was in the best interest of patient.
Well, you have a managing doctor, but that doctor also referred to another doctor. So it's like a lot of hands in a pie in one patient.
Right. And they're probably never all in the room at the same time talking.
They're all in different time.
Jeez.
So it's all on the nurse who is taking care of that patient and this specific shift.
Right.
And she has not only one patient, and that's another issue that is like
The amount of patients.
understaffing
Right.
on the floor. A lot of patients managed by one nurse who's supposed to follow all physician orders. It wasn't congruent and feels like patients get in the hospital and they never leave, specifically older population, because we know that is most of the older population covered by government medical insurance, and it's like sucking everything from the insurance possible from one hospital stay. So all money stay in the hospital and made by whoever can get those hands on. And that was my first impression when I started working, like how I can work in this system if it does not resonate with the way I used to practice. And what's the difference that in Russia, we practice integrative medicine. What does it mean? That besides prescribing medication, I can prescribe supplements, I can prescribe vitamins, and I can prescribe a lot of different modalities and even physical therapy. Physical, it's mean using physical devices like microcurrent, ultrasound, just to heal a patient. And for me, interest was the faster I heal somebody.
The faster you heal, the better
for them and also for me. Because and back then we had the social medicine. So for me, it doesn't matter. I see 20 people or I see 5 people because I was on a salary.
Right.
So the less people I see, the better for me, less time.
So if
for
you
the
can
same
get
money.
someone well, there's an incentive
Right.
for you to make sure that person doesn't come back because your time is valuable.
And he is completely different. And another interesting things that happened at the meeting that I attended was 2 more medical boards where all practitioners get together and discuss cases. At that time, I worked in the pathology lab. And we discussed a case about something like thyroid problem. And of course, endocrinologist taking care of people with thyroid problem. And he put a person on thyroid medication, and usually it's for the rest of patient's life. And pathologists ask question of endocrinologist, so how long that patient's supposed to stay on medication? And the endocrinologist said, well, probably for the rest of his life, because it's my job security. It's mean that that patient will forever follow that doctor, because that patient on the medication is supposed to be followed, takes certain medical, like lab testing to see the thyroid, panel.
But let's just back up. Western medicine thinks a thyroid cannot be repaired.
Right.
But we all know, we've seen it, that thyroids can be repaired and conditions of thyroids can be reversed. But yet the system won't even acknowledge it because there's no money clearly in a solution. And that's just such a heartbreaking thing. I mean, imagine a person being given a life sentence to, you're going to always have to be on this medication. And we don't know what that means because we've never studied it for 50 years for you to be on this, what other side effects are going to happen because you're on this, and what other meds you may have to go on because of this. That's not an answer. It could be a band-aid for a temporary situation until you hopefully can get figured out how to repair your thyroid. But
nobody even look at that. Why you have a thyroid issue at the first place?
Why would your thyroid have gone wrong? What is the roadblock preventing your thyroid from functioning? What is it either missing or what's preventing it from functioning?
And most likely it's a toxins. We already know.
Or it could be some major mineral deficiency that are all digestive, leaky gut. Because each thyroid person probably got there a little differently.
Mm-hmm. And so it's easier for endocrinologists put person on the hormones, which is a replacement of your hormonal function, thyroid function.
Right.
So what's happened with that extra hormone that come from outside replacing your own production, thyroid will stop working. Even though it had some small function, now it become non-functional, and you just force your thyroid shut down completely. The longer you take medication or hormone replacement, the less that organ gonna function, because you use it or you lose it.
There's no incentive for the body to do what it's supposed to do because you're replacing that natural function. So there's all these other consequences to you shutting off that hormone that your body now has to take a synthetic or some replacement form.
If you take that hormonal replacement for a long time, it's
Right.
gonna start affecting other organ because your innate hormones needed for the body, specifically for thyroid, we have thyroid receptor everywhere in every organ in the body. And if you give it external something that just need for thyroid, how about heart? So later on, you need another specialist. So usually after thyroid, you go to cardiologist.
Right. Well, right, because there's a direct connection. Someone has a heart condition, they probably also have a thyroid condition. They probably also have leaky gut if we get down to
that's
it.
probably was the first root
Right,
cause of
right,
the hormonal
yeah.
problem.
Right.
And after that, you go to the psychiatrist because you have a mental problem.
Because now your hormones are off, so why wouldn't you feel off and be unhappy and have other health issues?
So that's another issue in the American medical system. We have too many specialists and they don't communicate between each other.
I never understood why someone specializes unless it's only for money. Because you clearly aren't getting your patients well, and you never actually, as a specialist, you don't get to see the full patient because you're only seeing one body part of them. Why would someone be a specialist?
I think a lot of doctors get to medicine to help people, but when they get in the system, and particularly starting from medical school, when you get brainwashed with all pharmaceuticals and like putting you in a box that you treat this problem with this medication, you just become embedded in the system and you stop thinking out of the box.
Right.
Whatever your mindset was in the first when you went to medical school, you just become so narrow-minded, and that's what specialty is. You don't see the big picture because, first of all, you're not trained to see the big picture, and secondly, you just don't have time to see that. I call it capitalistic medicine, and it never worked because it's not in the interest to heal the people. It's just money-making machine.
It's interesting you bring up that argument because, one of the issues that we always hear in socialized medicine is that you don't get access to treatments or innovation stops, technology stops. But the argument is that if we go into more of a socialized medicine where it's all equal and doctors are made more standard money, that we will lose that edge of innovation, that surgeries, that emergency procedures will back up. What are your thoughts on that?
I don't think social medicine would work in a capitalistic country, even though I don't know how other countries use social medicine, like Canada. They have both parts. You can have a social medicine that you have access to everything, and you can have private practice that is, for people who
have means
and want to do that.
So there's the two-tier system.
And I think that is the best way it works. Same in Europe. You can go to your GP, but you can go to private hospital and private doctors. And I think that's the best way to have both worlds. But to have more family medicine or general practitioner who manage the patient,
the whole patient, instead of farming out all the different pieces.
And be versed in holistic approach, integrative approach, not only pharmaceuticals approach, but having all different pieces that you can have everything for the patient. Or another problem that I see also in the system, like I see that big hospital buying the small hospitals and buying more small hospitals to have one big system. Why? And I was wondering why they are doing it. What's the benefit?
Right. What's the benefit? Who's making money?
That hospital was working for the local people, right? Small local hospitals. They were taking care of all small people. Now it's belong to big system. So it again having more numbers for the system. And it does not benefit to small hospital because I talked to one of my friends who work in a small hospital. Now it's belong because the big system bought. So now they have to change everything in the hospital to be the same system as a huge system, and also all their patients now become a big system. And what's interesting for doctors, they force to keep patients in the system. For example, if my patients need some consultations that not available in the system, I cannot refer the patient outside of the system, go get help somewhere else.
So essentially, you have less access to care.
Yeah.
Well, let's not even mention that they're not actually offering lots of the alternatives, that need to be offered, whether from just actual physical therapy and physical body manipulation and nutrition, acupuncture. There's so many modalities that have been proven effective, and it's beyond question, let alone what we're coming into in the future, which is energy medicine and sound healing and some of these other modalities.
Yeah, and in Russia, we use all these modalities long time ago, and we still use it. We actually call it rehabilitation medicine.
Okay.
Or we call it physical medicine, because it's all this the physical modalities, like ultrasounds. It's kind of physical things that we use.
I was going to say, I had heard years ago that after a surgery, that a patient in Russia was going in and getting microcurrent to help speed up the healing.
Yeah. Yeah.
That's incredible. Well, the only ones who are getting it in the States are professional athletes who have access to that kind of speed up healing, healthy recovery. But it's so inexpensive. It would shorten the hospital stay. Well, clearly we don't want to shorten the hospital stay.
And also rehab clinics here, it's usually only physical. Physical, it's mean person working with you to bring your muscles, working and put you back to your normal routine,
right?
Not using physical machines that help your body to recover fast.
So we're not using these modalities that actually speed up the process. We're just doing actual humans interacting to kind of create physical therapy, even though there's a lot of tools that they could use that could actually speed up the process as well. It's almost like the system is so archaic at this point. I mean, this technology is 20, 30, 40 years old, some of it.
And so in Russia, after surgery, you go to see a rehab doctor, and he prescribe you what machines you use today, back to back. You go from one room to another room to another room.
To what would help you speed up and get well.
Like you go to ultrasound, you go to microcurrent, you go to maybe red light. And I remember when I was a kid, and my mom was working in a clinic, they have even for pregnant women to get exposed to vitamin D, what you need to do? You need a light.
In Russia, it's so cold and you're not outside as much.
North climates, you lack of vitamin D, and
is
usually
a major issue.
And so I remember pregnant women go to the room with the light, naked, staying with her belly, with the baby inside, exposed to light.
Trying to get her vitamin D absorption through light. They were actually doing that.
Yeah.
Wow, that's incredible.
And they have a different machines in each room. And when I was a kid, to get rid of cold, if you have a sore throat, you go to the room with the blue light that kills germs. UV light, and you set up, you put in your throat, and you sit for 3 minutes, and it kills your germs.
That's fantastic.
It costs almost nothing. It's like, it's so simple things, and it's not medication.
Okay, let's just say we are going to take over Western medicine. We're going to redo Western medicine. We're going to create a hospital that is a healing place. The sky's the limit. How would you describe that ideal wellness?
We didn't talk about food in the hospital.
Oh, we got to. The fact that you can have sodas and Doritos and like fast food as a patient in a hospital.
Yeah.
That's absolutely mind-blowing to me. The amount of sugar. I mean, sort of people getting chemo treatments and going and eating horrible things. It's heartbreaking.
In a room of chemotherapies, they have lollipops and candies.
And we know that sugar is like fire for cancer.
Yeah. It's not conducive for healing.
Clearly not. This is not where you want to go if you want to get well.
So let's create a hospital. Yes. And some hospitals already exist, like more open-minded, and some even private cancer treatment centers started creating
a more healing environment
where they have like a group of professionals or practitioners. They have different perspective, I know, and I visit one that have more holistic approach.
Cancer Centers of America.
Yeah, Cancer Center of America. When they take a patient approach from different perspectives, they have a naturopathic doctor, they have a nutritionist,
acupuncture, they have all those.
And nutrition they take care of nutrition as well, like what food they provide for patients. So there's some good things that it's not normal. It's
Right.
like not in a regular traditional hospitals. And I wish we could change it. So let's
Right.
create our ideal hospital where
Yeah.
when you walk in the hospital, it doesn't feel like it's a hospital and depressing place.
It doesn't feel a place of fear and death. It has to feel a place of light and love, almost like a spa. I mean, hospitals need to have that spa-like feeling of like, oh, I'm here. I'm gonna rest and recover. I'm gonna like take care of myself. The water is gonna be clean and not.
Or even
chemicals
sounds of
in it.
water
Yeah.
with the fountains.
Oh yeah, the sounds of nature and water and vibrations of great healing music and no
Hours.
freaking TV. Like, why would you put these awful TVs in hospitals with, you know, where people are watching all this horrible stuff? Like, why wouldn't you create a whole way to disconnect and heal? Where you have all organic food, there's no seed oils and anything. Can you imagine if someone was not well and had to be in a hospital for a week and they actually ate food that nourished and healed their body? What a difference that
So
would
they
make.
won't need a doctor. They won't
Wouldn't
need a
need it.
prescription.
No. I mean, they wouldn't even know what it is because no one's even told them what healthy food is. They probably don't even know that seed oils are causing their inflammation and so all of these different chemicals that are in our food today.
And they have somebody who can advocate for you, who
Right.
take care of your whole body or whole presentation and talk to different doctors from
Right.
your goal. What do you want to achieve?
Western medicine never asks you, oh, why are you here today and what do you want to achieve? And they're just like, what's wrong with you?
Mm-hmm.
Well, there's nothing wrong with me, but I would love to not have these symptoms. Can we figure out why I'm doing that? And it's just a different mindset.
And unfortunately, patients don't go to doctors until they can function anymore. Because you can't go to doctor if you don't have really problem. That's the
Right,
problem.
I mean, that's
We
the
don't-
problem. If it's not a major symptom, what's the point of going there?
For doctors, there is
Yeah.
nothing that they can offer the patient. So,
Unless they have major things
Right.
that they can put a pill
so
to.
they can have a diagnosis, or they can send them to labs, so to confirm their diagnosis, and also to prescribe for that specific label of diagnosis. In America, we don't do preventive medicine
Right,
as we do in other countries. It's
Right.
much cheaper to prevent something than to treat.
to treat it.
But
Well,
doctors
and
don't have that money to live on.
I make the argument when you get the headache or when you get the digestive symptom, it's your check engine warning light. And that, if it's just one time, okay, no big deal. But if it is a continuous pain or continuous irritation or you have brain fog or you're starting to have a knee problem, it is like, okay, let's figure this out now. And let's not wait till 6 months to a year or two where now we're having to have a major intervention. If someone's starting to have some of these minor symptoms, what advice would you give them?
So this is your body tells you that something is wrong and you
Right.
need to take care. So listen to your body.
Right.
That's
Right.
the first thing that you say to yourself. And
You have to check in with yourself and
Right.
say, hey, I have a headache. What are all the reasons I could have a headache today? Dehydration. Did I eat something that's wrong? Am I watching too much screen time? Did I get enough sleep? You could go through the list. Am I breathing correctly?
you know about that because you already went through your journey and now you know that.
But
But
most
most
people
of the
don't.
people don't even aware.
They don't even know where to start and
Right.
check in and say, oh, I have a headache. Well, I just had an argument with my boss.
So to connect people to that awareness, they need a practitioner like you and me who make them aware, to educate them. So that's why we're educating here on our podcast, to at least have the knowledge, at least to check in. Is it something like that I can do myself?
Right.
Or I need to really go and see a doctor. For example, I feel dizzy and I lost conscious and
Yeah.
it's happened first time. I get scared and I go to doctor. When you go to doctor tests all signs and
They
vital
try.
signs.
They try, but I
nothing
get
wrong,
pretty much
everything is
yes,
normal.
That's right.
They send you to testing. They send you to all kind of diagnostic studies and labs. Everything come back in normal range, which is normal range we know is like
Not optimal. So if you're normal, you're probably not optimal.
we have such a problem. It's the system is broken because where those normal range come
Right.
from in the lab, from testing thousands of people who come to their lab for a few years, because people who go to lab usually not well.
Right.
So if we take that normal range based on people who usually go to the
Can
lab
I
and
see the blood work of every Olympic athlete? You know, can I see the blood work of all the superhumans? And now I want to know how far away I am from the superhumans who have great functioning mitochondria, they have low inflammation. Like, I want to match that. And then you could start to actually get some answers.
And also, if you compare normal ranges in America to normal ranges in Europe, that's completely different.
Okay.
And if you see even normal ranges in America now,
Right.
to 50 years ago, it's completely different also. Because first of all, now we have more sick people. That's why normal ranges are going up and up and up. Because when they create those normal ranges, it's usually like bell curve, right? You have people with this range, this blood work, and this blood work, like two extreme, and they take that middle part and become its range. But now people become sicker and sicker, and this is shifting this way, so the normal ranges change.
Right. No one wants to point that out. Well, and I saw a statistic of how few people are metabolically flexible.
Only 12%.
Only 12.
88% not metabolically flexible.
That means 88% of Americans are not optimizing how their food comes in their body in order to make energy. They're having blood sugar issues, they're having inflammation, they're having digestive, they're all of these things that are off in their system. So only 12% of us, you're one of the 12%. I'm working on being one of the 12%.
I wasn't there only 10 years ago, so you can always shift.
You can shift.
And get your optimal health.
And that's the thing. I also think that the seed that needs to be planted is that I don't care what health condition you have, it can be reversed. I think there's so many people who think they can't. With a very rare exception, most things can be reversed.
Yeah. Unfortunately, people who come to us, they already been so many doctors, and they were very discouraged that, oh, it's something happened, you're just not lucky person, you have this disease and that disease. And like, you just get on the medication, that's what's your best to do. How you can be better. And people get discouraged, or they've been on medication for a long time, and you get another medication for your side effects.
What is the number? Isn't it 75% of Americans are on a form of medication?
Yeah. And even kids now.
That's heartbreaking. How few kids when we were younger were ever on a medication and now are on medication. The blessing of 2020 was, I think it was this awakening moment, this eye-opening moment of how unhealthy we are as a population. Like, there is no excuse for 75% of a population being on a medication. It's just hard to wrap your head around it. Like, that's not health. That's,
and finally, thanks to COVID, they start talking about metabolic unhealth, right? Because
we knew said that people would have a harder time of survival if you don't have healthy metabolic health. Diabetes, obesity,
high blood pressure. And now people scared to be not metabolically healthy and start changing their mindset and how they approach to their health. And so hopefully we see the shift with people, average Americans population that usually go to doctor, they start thinking differently.
And when I see someone who is obese, I think I see a malnourished person. There is something so messed up in their system that's not functioning. It's a body that has gone haywire, that's malnourished, and continues to have to take in sustenance just to meet their bare minimum, and because the system is broken. And so I often think if you can get in and heal the gut and help the thyroid and the endocrine system and the hormones, like, you can start to unravel why that person is carrying that weight. But we have to get to the root cause. And there can be emotional. I'm not going to discount that too. But something's gone haywire in that person. It is not their choice that it went haywire. And we have to help them kind of put it back together. There's also very thin people who have hyperthyroidism. And, you see it, but they'll eat and eat and eat and never gain weight.
Yeah, because the metabolic something is going on with them. Yeah.
Right. They have a roadblock that they have to address too. So you can't actually just always look at a person and understand the level of health or non-health in a person.
Yeah. And also affect and influence of pharmaceuticals companies on what doctor prescribe and what people see on the TV, because
So we'll back that train up too in the West. We're only one of 2 countries in the world that allow pharmaceutical ads on television. And if you truly understood how impressionable we are and how influenced we are and the energy and power of words cast spells, spelling, like we are being brainwashed in our society with this programming that we're seeing around what we think is news. Some of the worst offenders are the news stations that are allowing these ads on the air and have only created such sickness in this country and such chronic disease since we've allowed those advertisements.
So America and New Zealand.
America and New Zealand are the 2 countries. Man, if
Both
we could just
reference.
change that, how would health become different if we no longer allowed pharmaceutical ads on television?
And it can be changed very easily.
Oh, I mean, people are going to scream bloody murder because they're going to lose a lot of money, but maybe we'll actually start to gain what real health is. My other soapbox issue in 2020 is no one came out and said, how do we get healthy? How do we have a robust immune system that can withstand anything? What are some of the basics? We didn't talk about going outside and being in nature and walking and moving and breathing and drinking wonderful water and healthy food, connecting with your friends and loved ones, having healthy relationships. Like, there's some basic things that create health, and we couldn't even have that conversation.
But nature thrived
during
COVID.
That's right.
Because there was less interruptions for them.
The skies look so beautiful. That's what gives me hope, that we can reverse it all. It just takes a little bit of effort. And, you know, we help our clients one-on-one reverse. We ourselves are working on reversing our own stuff. That's what we want to leave people with.
Yes.
A message of hope that you are not your condition or your dis-ease in your body, and that it's all fixable, reversible, changeable.
Also, if you see a physician who can help, because there is so many practitioners are out, open-minded physicians who can help.
Oh, there's some great functional medicine doctors who are looking at all the modalities. And so I often say, if you're coming straight from Western medicine, you're not quite ready to dip your toe into the woo of energy medicine and the quantum physics world, there's lots of great in-between doctors. At a bare minimum, I tell people, do not go for Western medicine, go for a functional medicine doctor, at a minimum. Because they will actually start to treat you as a whole person, and they will offer in some of these wonderful modalities that are not just pills.
And listen to your body. Anything that your body tells you, it's all messages that something is going on.
Right.
So go on to see practitioners who can look under the hood and go to the to the root cause, or go upstream.
Go upstream,
maybe even on a cellular level, and maybe you start removing something your body doesn't need. Find something that personalized for you. Maybe change some lifestyle and nutrition. And it can be very easy. Just drink more water. Clean water.
Right. Structured water. There's a whole podcast coming on that.
So it can be done very easy. And find maybe supportive community. Community is very important. If you don't think you have family that's supporting you in your journey, find other family.
Create those relationships, those friendships. Create people that you feel good to be around, that light you up.
Or if you don't have a community, create one.
Right.
Like we created.
You right. That's right. I mean, one of my favorite things, Dr. L, is that I found you through Functional Medicine Forum. Tell me the origins of this, because you've created this a while back to just help alternative practitioners connect and share best practices.
So I found about James Maskell, who started Functional Medicine Forum back in New York 10 years ago. He is not a doctor, he is medical economist. That's his profession.
Wow.
And he's continued doing it. Functional Forum meetup. He started in New York in person. It was a small group, and the functional medicine that time just started to come out on the market, and people start talking about it, and Institute for Functional Medicine, they work in collaboration. So a lot of doctors who started doing this work wanted to find like-minded people community, and James started that 10 years ago in New York, And I probably found about it a year after they started, and I create my own group. So his goal was to create that kind of small local communities in each zip code in the country. So first of all, we wanted to connect to each other, to know each other, because sometimes you do something that is out of the scope of regular, like conventional medicine, and you feel like you're isolated. And sometimes you're even scared to do this work, because a lot of doctors even lose their licenses by doing something that is not conventionally acceptable.
Right.
Their colleagues think that they're weird and they expel them from the practices. So I wanted to connect to other practitioners in our local community, find them. And I found you, and we started a group, Functional Forum Meetup of Philadelphia Main Line. We grow now to big community, and I'm running it now for about 9 years. We have a core group of people who comes meeting every month, and we share our practices, we share about what we do, and we have speakers, we have different topics that we talk about.
That's the kind of community I've always wanted to be a part of, is this idea that I don't have all the answers, and I want to learn what other things everyone else is bringing to the table, because I know that when clients come through or patients come through for you, that maybe they need to go see somebody that's a specialized. I was thinking of Dan and what he's doing with Paragon Pain Solutions, that you need to have some alignment issues checked out in your body. Like maybe that joint pain you're having is actually because you have an alignment issue, and there can be an emotional component, but it also could be some kind of actual physical alignment, that just changing a muscle or activating a muscle could make a huge difference.
Yeah. When I work with my clients, if I need them to see a chiropractor, of course I would refer to somebody in our group, because I trust them, I know what they do, I already experienced their own work on myself sometimes.
Right.
So I trust them.
Well, that's actually my other favorite thing, is I go try out all the practitioners that I meet at Functional Medicine Forum, from hypnosis and it's with Nick.
And we have all kind of practitioners in our group, and I'm so happy to know them, so I can easily refer my patients that I cannot help with, like intuitive healing and a chiropractor and massage therapy. And that's what the community for. If I cannot deal with something or cannot help myself, I see help from other practitioners in our group, because we know each other. And
I love that.
Very, very good that we have that community, and I'm glad that you're part of it.
Oh, I'm so excited about that. And it just reminds me that, maybe the next phase for this is to create an online community, so people can have access to all the different modalities, but also how to refer people back and forth. It's creating these communities of trust in these areas, so that you can support people wherever they're at, and they can track down and locate people. But the first thing is, like you said, get in touch with who you are, figure out what's going on, start to ask the question, and then start looking. And if you can't find the answer you're looking for, keep looking.
Yeah.
Because you will find someone that can help guide you, and then just keep checking in. Is this person still helping me? Am I still moving forward, or do I need to figure out something else? And then, but be aware of what's going on with you. Don't just keep looking outside of yourself for the answers.
And believe that you can heal yourself. Yeah. No one can heal you, just you. You have a power to heal yourself with a lot of different things that your body already provided.
Right.
We are here, we are born already with healing modalities in yourself, so we already know how to heal, and we are here only to give you tips, tools, and maybe bring awareness that you can do it.
I love that. We have to end with that. I mean, you can heal yourself, and that's the real message, is that it's an inside game.
And we need a medical system maybe for emergency, and we know that American medical system is great for that, but not to heal some things that deep in your root and even in your past life, who knows? So
that's a whole other topic. I can't wait till we get on that one. Well, thank you so much.
Thank you. It was nice.
What a treat. Always so much fun.
We hope you enjoyed today's episode of Harmonic Alignment. If something resonated with you, we would love to hear about it. Please consider leaving us a 5-star review and subscribing so you don't miss an upcoming episode. Thank you. The information contained in this podcast is provided for informational purposes only and not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and directions. The products and information received through the podcast should not be used to replace a consultation or advice from your healthcare provider. If you suspect you have a medical problem or have any healthcare questions, please promptly call your healthcare provider. This podcast, including Dr. Larissa Sharapova and Priscilla Koblentz, and the producers are not responsible for any possible adverse effects from the use of information contained in this podcast. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct financial benefit to the product or services referenced.